Hi, welcome to the Unite Jones channel with me, Chris, where we talk about everything fitness, physio, well-being related. So today what I thought we'd talk about is whether rehab is actually worth it. So the reason for this is I just wanted to demonstrate or talk about how effective rehab can be as opposed to delayed access to physio, or not completing the exercises, or not carrying on with what the physio has prescribed. If there's any breaks in the chain as well, so not accessing rehab quickly enough, not getting the referrals to the right places, or just ignoring the injuries that somebody might have. So I thought we'd talk about two patient journeys, and then just try and demonstrate what's happening in both patient journeys. So we're going to talk about a man called Dave and a woman called Karen. They're both mid-40s, early 50s. They've got COPD, so that's chronic obstructive pulmonary disease. And they've smoked in the past, and that's the reason why they've got COPD. So as you can see, both the same really. They both like to exercise, but they've both had a new diagnosis of having a new long-term condition. So let's have a little look at Dave first. So Dave goes to the GP. He's been told that he's got COPD. The GP will then give him advice about managing his condition, and how exercise can benefit him. So on that referral, she'll then refer him straight through to rehab services, and there's no delay in that, because the process from the GP recognising about the improvements or the benefits of rehab that rehab can have, she'll get that straight over to the rehab team. So then we have a little look at Karen. So she gets her diagnosis that she's told she's got COPD, but some of the wording that the GP uses is that it's irreversible, caused by the smoking that she's had. So already there's negative impacts on that. So she's not going to be able to do anything about it. The GP, rubbish GP, just gives her a leaflet, sends her on her way. No more information other than this piece of paper, which is reliant on Karen reading it, understanding it, but not having any access to any further anybody to have a conversation with about it, further explanation. And then the GP says that she can't refer her to rehab in that location until the condition is deteriorated. So bit of a change to how it's managed with Dave and with his GP. So then Dave continues to work and exercise. He's following his advice from the rehab services. Once he's got his appointment through, that's come through quite quickly because the GP's been on it. He's obviously in his mind, he's thinking, okay, I can keep doing things because I've had a good conversation with my GP. I know that exercise is going to be okay for it. I know it's not going to make it any worse. So let's keep going with my usual routine of exercising and working as well. So he wants to keep working. He's self-employed, might be a tradesman, wants to keep providing for his family. Let's not forget, he's only in his mid-40s, 50s. He's got hopefully another 10, 20, 30, 40 years left in him. So he's wanting to continue with his life as usual, as anybody would. And then we look at Karen. So Karen's got this absolutely awful GP who's not give her any advice, just give her this crappy leaflet and used some unhelpful words. So Mary thinks, okay, I'll just stop exercising. Like, there's no point. It's irreversible. So why would I just carry on? And because she stops exercising, her COPD gets worse. Her condition deteriorates, and then she needs an admission to hospital because that's got worse. So she's got more breathless. She's coughing up a little bit more than she was before. She's more likely to have infections because she's not doing the things that she was before. She's not maintaining where she was. And obviously she's gone into hospital. So even with that hospital stay, she's only mid-40s, 50s. So that first hospital stay is quite significant for her. So in hospitals, you're not doing what you would usually do at home. You're not managing to, you wouldn't be expected to cook, clean, get up, do that sort of stuff. There is the case of being a patient in hospital as well. So you get PJ paralysis and told to stay on the bed or not moving as much because there's a lot of risk aversion. So she deteriorates in her function. She deteriorates in her ability, in her mobility. So then, because she's deteriorating and deconditioning, she then gets back pain as well because she's not moving. She's not doing what she was doing before. Meanwhile, back in Davetown, he's attending his appointments. He's being seen by an MDT. He's getting his holistic assessment completed. He's having excellent expert advice from physios and by nurses. And those people are all interlinking with each other as well. So they know about Dave. They know what's happening with him. He knows what's happening with him as well. He knows where his saturation levels should be. He knows that what his exercise tolerance is like and what his level of effort should be when he's mobilising and when he's exercising. So he's got a better education about what's happening with his condition. Then in Karenville, so she's had to take loads of sick days. Because of her bad back and because of the breathlessness, she's not able to carry on doing the job that she was doing. So combined with her sick days and without being able to do the job that she was doing before, she eventually has to lose that job and think about where she could utilise her skills. But it's a lower paid, insecure job. It's not the job that she had previously, the security and knowing that them wages were coming in. She's now having to be on a 0-hour contract, and she's de-escalating into a bit of a rut, really. All because these things are having a massive impact on her quality of life. And then Dave, so he's got his MDT, but he's still managing to juggle work, exercise, and manage his condition as well. So the rehab team start to do video links with him, start to do his exercise program over Teams or over Skype even. So they're engaging with him in different ways and making sure that he follows his exercise program, that he's educated on his exercise program, and he's managing to maintain his quality of life that he had at the start of the diagnosis because of continuing with the program of care that he was receiving. So because all this is happening to Karen, she's now become depressed. Her breathlessness is worsening. Her mobility is even worse than it was before. She's seeing multiple consultants because of issues with her back and issues with her breathing. What's happening with work as well, because she's not in that stable job anymore, it's also impacting on her mental health, and because she hasn't got the quality of life that she had before, it's all quite a negative vibe that's going on, and it's just a tornado of depression and not coping and limited support. So Mary then has another exacerbation of her COPD, and she's got to go back into hospital. And this time though, she's got to spend 5 days in hospital, not just a night or two. This time it's a longer length of stay, and it's a longer time that she's not at home, and she's worrying about her bills. How's she going to pay it? Because this is an insecure job that she's got. It's 0-hour contracts, so she's not going to get that money in. It's not going to pay her way, and she might lose that house that she's in. So she's got the depression, she's got the mental health issues, she's got the physical health issues, and it's all having a massive impact on her. Eventually Karen gets home, and then her referral for rehab comes through a couple of months maybe after. But then, because the impact that it's had on her low mood, the impact that it's had on her quality of life, the impact that it's had on finances, on her job status, on her personal status, who she is, what she was doing before, is massive, and it's all reduced. So this appointment comes through to rehab, and she looks at it and she thinks, well, the condition's irreversible. It took ages to get through. There's no point now. I won't go to rehab. So the fate of Karen is that she's not going to get the rehab support that she needs. She's not going to get the education that she needs. She's not going to get the MDT that she needs. All because at the start of this, it was quite negative, and it wasn't put in place quite quickly, and there was no linked up thinking, and there was negative language used. So just from all that beginning, then escalates into her not wanting to attend the rehab because she doesn't think it's going to be of any benefit for her, when in actual fact it could have been quite different. And that's when we go back to Dave Town. So the difference is with Dave, he's had the MDT support, he's had the positive language around what her condition was, he's had the quick referral in, and the GP was understanding of how imperative getting that referral across was, and the effects of what exercises can do for that condition. So when he's reviewed, he's confident that he can manage his own condition. He's confident that he can manage his breathlessness, and that he's maintained his activity levels, and that he's maintained his work status, and that he can maintain his quality of life for a lot longer. So when we're looking at both of those individuals, they've both got the same condition, and they're around about the same age, doing the same things. But one, in terms of Dave, one has had a GP that understood where that referral should have gone. He's had the MDT that understood exercise was good for him. He understood why exercise was good for him, because he can manage his own condition, and it's not on somebody else, and it's not on tablets or inhalers and things just to manage that condition. obviously they're brilliant in managing the condition, and it should be worked as an MDT, but he managed to do the things that he wanted to do before, because nobody wants to be on inhalers, nobody wants to be on medications for long term, and that's what Dave was able to do because of the access and because of the communication and because of what was happening and understanding why rehab was important. And then Karen, it all started with the lack of appreciation of what rehab can do and the negative language that's used around a certain condition. So, and it's the same when you're talking about back pain as well, the amount, and osteoarthritis as well. So the amount of patients or clients that come to me and talk about slip discs, there's just loads, and it's all about the education that then needs to be given to that patient. Discs can't slip, man. Discs can't slip. But then I've got to spend an hour or two educating that patient and client about why discs can't slip, instead of just getting straight into the exercises and educating them about what exercises they should be doing. I'm taking out more time to educate them on all of the beliefs that they've had because of being told that they had a slip disc. So when Karen's being spoken to about the COPD and it being an irreversible condition, it can be well maintained with exercise, and we should as clinicians be able to try and have those conversations and portray it in a more positive way, or at least the things that can be done should be portrayed in a more positive way. And when I'm talking about osteoarthritis as well, so there's been a long-standing belief that it was a wear and tear, but it's actually a wear and repair issue. So having those conversations, bone on bone, really, just really. So those sorts of things, when clinicians and medical staff are having conversations with patients, all these patients have got these long-standing beliefs because that's what we used to believe, but now we need to sort of reteach them what these conditions are and what can be done for them. So, but then it impacts on how we as clinicians then have to, the amount of times that we have to have the education sessions, and those patients might be, no, I don't believe what you're saying to me. So then it impacts on the treatment that we're having. Another consideration for me is when I'm thinking about whether rehab is worth it and whether somebody needs to do their exercises is I think of it as investment. So I wouldn't pay a plumber to fit a toilet and then piss on the floor. So what I mean by that is, if you're paying a physio or if you're paying a consultant or a personal trainer even, if you're investing in your body, do the exercises. Because otherwise you're just paying that physio or that personal trainer or that consultant money for nothing. So one thing that absolutely winds me up is if I've given a rehab plan, or if I've given somebody some advice about their condition and what's best for them and why they should be doing the rehab, if they don't do that, there's no point in me going back and seeing them, and no point in me continuing with the treatment, because I can't fix things. I'm not magic. I wish I was, but I'm not. I think the difference is, in that analogy, is when you invest in a house, somebody else is doing the work for you, and you can see that change instantly. Whereas when you're investing in yourself and you're investing in rehab, you've got to put the work in. It takes effort, perseverance and patience to get back to where you were before. And if you're not willing to do that, there's no point in paying for a physio or a personal trainer until you're at the point where you know that you are dead certain that you're going to crack on with them exercises and that activity, and you dead certain that you want that change. I wouldn't bother wasting anybody else's time until you're at that point. That being said though, with rehab, it's important that it's put in place early, and it's important that it's done early. So if there is an injury, or if there is a need for rehab at that point, access it quickly. Access it quickly, because otherwise the complications of not having the rehab and the support quickly could result in you being a Karen, and could result in you not living as optimally as you could be. So when I'm talking about injuries, what I mean by that is even ankle sprains, wrist fractures, any sports injury really. If you don't get the access early and the right support early, here's an example, is a lot of the time, so back in the day we used to say it was Price or Rice, rest, eyes, compress and elevate. However, the times have changed again, so now it's peace and love. So it's a different way of managing things, and if you don't know that, and you don't know how to manage that injury effectively, you could be doing yourself a disservice, and it could take you longer to recover as well. Whereas if you pay a physio to help you recover, they'll know that. They'll know that, and they'll know how to manage that injury effectively, and they'll know how to rehab you to where your current level was, and they'll know how to increase your strength, increase your endurance. They'll know how to have a little look at your proprioception and work on exercises for that, so that you don't re-injure that ankle, or you don't re-injure that wrist. You strengthen the bones. They'll also know about time frames as well, how long it takes for bones to recover, how long it should be, or they should know who to contact before you can return to the certain activity that you want to return to. So one of the other reasons why I think that some people don't value rehab and physios, sports therapists, AHP in general, is because we do a lot. Some of the services that we provide are then taken for granted. So a lot of people will ask me for free advice, free exercises. Can you just assess this? Can you just assess that? Can you have a little look at this? Oh, my cousin's brother has also got a bad ankle sprain. Could you just give me some advice on that? Now, if I was a tradesman, if I was a plumber, if I was a carpenter, a builder, I don't think they'd be asking me to build them a free house. I don't think they'd be asking me to come and fit a wardrobe for free. But because my skills and physio skills, AHP skills, are about the knowledge and about the expertise and about the experience, a lot of people don't see the value that has. So they just expect me to give that advice across, and expect that I will assess them for free. When you're asking for that advice, you're not just getting exercises, because anybody can give you exercises. What you're asking of me is to utilise my 20 years of experience in sports therapy, in physiotherapy, in fitness, health, utilise all that experience and knowledge to help you perform optimally or recover optimally. So when you are thinking about asking a physio or an OT or ambulance staff or speech and language therapists, any of the AHP roles, about just a quick assessment, it's not just a quick assessment for us, because it may seem like that, but that's because of our experience, our education, our knowledge. But it takes a lot of effort to get to that point, to be able to give you an assessment within a certain time frame. So when you are thinking about that, think about you investing in your body and you investing in yourself. Because if you're willing to invest in yourself, and if you're willing to pay the money to get the advice, to get where you need to be, then yeah, get in contact with the physio, get in contact with the personal trainer, get in contact with the speech and language therapists, the OTs, the dietitians. Get in contact with them, because you know that you're ready to do that. Then you will put the effort in. If you're paying £50 a session, you're paying £70 for an initial assessment, you know that you are fully ready to put that effort in to make the changes for yourself.